Hello, welcome everyone. Before we begin our presentation today, we would like to begin with an acknowledgement that N4 is hosted at CHIO, which is located in Ottawa, Ontario. Ottawa is built on unceded Algonquin and Anishinaabe territory. The peoples of the Algonquin and Anishinaabe Nation have lived on this territory for millennia, and we honor them and this land. Their culture and presence have nurtured and continue to nurture this land. We also honor all First Nations, Inuit, and Métis peoples and their valuable past and present contributions to this land. My name is Colleen Drake. I am N4's Project Engagement Coordinator. I will be hosting and moderating today's presentation with my colleagues and co-hosts, Mariah Maddock, Team Lead Knowledge Generation and Mobilization, and Andrew Tomeyer, Education Coordinator, who will be monitoring the Q&A box today. I am now pleased to introduce you to today's presenters, Karan Coetzee, Alex Tran, and Luxshi Amirthalingam. Karan Coetzee recently moved into the position of Director, Research and Analysis at Touchstone Institute, and has worked extensively within the internationally educated health professional pathway to registration landscape over the past 6 years, particularly in terms of competency, equivalency, assessments, and their psychometric qualities. For the nursing landscape in particular, Karan has helped design and implement performance and knowledge-based assessment components for internationally educated registered nurses and registered licensed practical nurses. Alex Tran has been a member of Touchstone Institute since 2008. He was appointed the Director of Examination Administration in 2017 after a number of years as the manager of the assessment unit. He has extensive experience in assessment and has been a stable contributor to the development of exams in many different healthcare professions. He has implemented standardized assessment policies and procedures to streamline exam development and exam administration. Most recently, Alex has led the implementation of the content management system, including the use of tablet-based item management solutions for exam administration and examiner scoring. Alex holds a criminology degree, has a strong foundation in data management and analysis. Luxshi Amirthalingam is a data analyst coordinator in the Research and Analysis Department at Touchstone Institute. She has worked with the organization for over 6 years. Prior to joining the research and analysis team, Luxshi has also worked with the Cellban exam unit as exam coordinator, working more closely with IENs, hearing their experiences with nursing pathways in Canada, and working on various projects related to the language proficiency nursing assessment. Today's session is being recorded and will be uploaded to our N4 platform. We will share this with you as soon as it becomes available. Should there be any technical issues during the presentation, we will inform you with details for an alternate makeup session. Before we begin today's event, I would like to take a moment to introduce you to our platform features to help enhance your participation experience. Throughout today's session, we invite you to write your questions in the Q&A window. We know that sometimes many of you might have the same questions or be interested in a particular response. Today, you have the option of upvoting a question. Please upvote questions you're interested in hearing the answer to, and we will prioritize which questions we pose to the speaker first. With that said, let's jump into today's presentation, and I will pass the virtual podium over to our presenters to take it away. Welcome, presenters.
Good afternoon, everyone. My colleagues, Karan and Luxshi, are the main attraction today for this webinar presentation. I'll just provide a brief overview of who we are at Touchstone Institute. Touchstone Institute is a not-for-profit organization established in 2006 as a component of the Ontario government's strategy to address health human resources demand. We have focused much of our attention to providing solutions for internationally educated health professionals with the opportunity to demonstrate their skills and knowledge through standardized assessments and learning programs. Over the past 12 years specifically, we have gained extensive experience working with nursing regulators and nursing subject matter experts who have helped us develop our exam content, blueprint, and identify competencies for our nursing assessments. We facilitate these objectives and goals through intensive workshops and validate our exams and content with pilot and field testing. We also have an in-house simulation team that trains and prepares standardized patients and clients to portray a role in scenario-based encounters. Our database pool of subject matter experts and standardized patients and clients are in the several hundreds. We are also aided by a purpose-built facility in downtown Toronto, as well as having partner sites across Canada and an exam administration team to administer our exams, both virtually and in person. I will now hand things over to Karen.
Thanks, Alex. So Touchstone Institute occupies a significant space across the internationally educated health professional landscape in Canada, and in particular with regards to internationally educated nurses. This is in terms of both assessment and learning programs. So just to give you some insight to the programs that we do design and administer, one of these is known as the Registered Nurses of Canada Competency Assessment Program, which we commonly refer to as the RNCCAP. This is a recently updated competency equivalence exam, which is delivered either in person or virtually. It's currently accepted in Ontario and Alberta, but the exam can potentially be used nationally as it is based on the National Entry to Practice competencies for registered nurses in Canada. We then also hold the Alberta Licensed Practical Nurse Competence Exam, or ALPNC. This exam is similar to the RNCCAP, but for licensed practical nurses seeking registration specifically within Alberta. And then also in terms of our assessment component piece, we have the Canadian English Language Benchmark Assessment for Nurses, also referred to as CELBAN. This is a nursing specific language assessment for English language proficiency, or IENs. So turning our attention to our learning programs, here we have two significant programs, the Communication Through Simulation, or ComSim, as well as Nurse Ready. These two programs are geared towards increasing communication strategies for IENs through formative strategies. So we actually are particularly pleased to share the launch of Nurse Ready. This is our most recently developed nurse initiative, which is a first of its kind mobile app for professional nursing communication designed with IENs in mind. So if we move on to the next slide. So if you are interested in the Nurse Ready app, it is free to use and was designed as a resource for IENs to access at any point in their pathway to licensure in Canada. You can just pause on this slide for a minute or so if you would like to scan the codes for either the Apple Store or Google Play to gain access to these apps and experiment and look at it for yourselves. The Nurse Ready is a self-assessment tool utilizing artificial intelligence for diagnosis and customized feedback on the communication competencies required for nursing certification and practice. The app was developed by Touchstone Institute with funding from the Government of Canada's Foreign Credentials Recognition Program. I'll just give you a few more seconds if you would like to gain access to that app through the codes on the screen. Otherwise, you could also just search it up in the stores depending on the device. Okay, we can move to the next slide. Not to spend too much time on this slide, this is just to give everybody an indication of the other internationally educated health professionals that we serve at Touchstone Institute. So these would be assessments and also learning programs geared towards internationally educated optometrists, dietitians, as well as physicians. And there's a list of those 6 pieces or components that we also administer, develop at Touchstone. We can move on. Right, so turning our attention now specifically back to internationally educated nurses and the assessments there. Although acknowledging that it is changing at a rapid rate, typically an IEN on the pathway to registration will encounter the need for completing an assessment in 4 main areas, namely language, competence equivalence, jurisprudence, and licensing. So the CELBAN, RNCCAP, and ALPIN-C, which were described on the previous slide, are those that are offered by Touchstone Institute. And the need for an IEN to complete assessments in all 4 of these areas, or simply only 1 or 2, with typically the jurisprudence and licensing exams being mandatory, is of course both IEN and province specific. Nonetheless, the remainder of this presentation will focus mainly on that second area of assessment that's circled in red, which is competency equivalence assessment. We can move on to the next slide. All right, so the question is, what do we mean by competency equivalence exams? So just as a reminder, regulators will typically employ these standardized exams to assess an applicant's level of competence when, for whatever reason, this cannot be determined through other avenues, such as a paper-based credential assessment. The employment of a standardized exam in these circumstances is highly convenient, as they're designed to assess many candidates on several competencies over a relatively short period of time and can produce valuable results or information in 2 main ways. So firstly, these assessments can provide an objective decision. So basically a yes or a no as to whether this applicant possesses a substantially equivalent level of competence against a predefined standard. So for instance, we ask ourselves the question, is this applicant equivalent to a recent graduate of an approved Canadian program? Secondly, and we can move to the next slide for this one, the second piece of valuable information that these assessments can provide to us is that they can provide profiles highlighting individual competency strengths and weaknesses against the same predefined standard. And this information will help target directly the remediation needs. This kind of information can be used at both the individual and group level. So in other words, the assessments serve a role of assessments for learning when used to their full potential. So moving on to the next slide. So competencies can be measured using various formats of examinations, but the performance-based objective structured clinical exam, commonly referred to as the OSCE, is often considered the gold standard. These exams, which are not only really reliable and valid, also afford the candidates the opportunity to display their clinical skills in simulated settings that are closely resemble their real-life practice. And so they are therefore also considered more of a fairer way of assessing competence. So moving on to the next slide. So in the pre-pandemic world, so the information that I've just given you really has built up the context of competency assessment and their background. But in the pre-pandemic world, competency equivalence assessments were commonly positioned as gatekeepers for public protection. For the most part, regulators and candidates, although arguably probably without much choice, were satisfied with the arm's length solution for public safety that these tools provided, as well as a steady flow of potential professionals into the system. So although not perfect, the system functioned relatively okay. We can go on to the next slide. So as with many things, once the pandemic hit and intended fully to overstay its welcome, the status quo was challenged. So health professionals were forced to accept the imminent skills crisis, and internationally educated graduates were quickly recognized as a key resource. The position on competency equivalent assessments soon shifted from gatekeeper for public protection to barrier to public protection, and this shift was certainly felt. The necessity of such a shift within a troubled system was recognized, as well as the positive developments that arose from this. So for instance, it did force regulators to rethink pathway options. It has given rise to a louder IEN voice. We heard this voice at one of the last N4 webinars when we heard about the report findings. and has encouraged assessment organizations such as ourselves to evolve policies and procedures to better suit the context. So for instance, our CELBAN exam, the language proficiency exam, now recommends a longer validity period of results, has removed limits on the number of retakes, and has transitioned to a more accessible virtual rather than in-person format. We've also come to recognize a larger value that assessments play within this system. And that being that the data it produces and the potential to leverage it to contribute information back through various research and information sharing initiatives. And this is really the primary purpose of our presence at this webinar, and is really a case in point. And so with that being said, I'd like to invite my colleague Luxshi to share some of the findings from our research surrounding IENs and based on some of our assessment data. We've also had the privilege of sharing these findings and research at some of the conferences these past years. So I'll hand it over to Luxshi.
Thank you, Karen. So we conducted an earlier study that was intended to share some numbers from the field, one where we work closely with IENs, and we wanted to explore areas where we can contribute to our understanding of how to support the integration of IENs into the healthcare field. A closer look at the populations and numbers that we're working with, particularly in this sector, will help shed light to regulators on the importance of credential recognition and initiatives to support a sustainable system for skilled immigrants. So to do this, we administered a survey, an online survey, to over 1,000 IENs in 2021, referred to as by the College of Nurses of Ontario, to complete the IENCAP competency-based assessment, which is now transitioned to the Registered Nurses of Canada Competency Assessment Program, or RNCCAP, the competency equivalence exam described earlier as offered by Touchstone Institute. And this is as part of their pathway towards registration. These IENs had already completed the IENCAP between 2013 and 2021 and had a candidate profile with us at Touchstone Institute. The data was analyzed to provide insight into this critical subpopulation, who these candidates are, and their professional outcome post-assessment. The survey was then closed in mid-January 2022, and a total of 301 IENs, which is roughly 30% of the pool we sent it to, returned completed surveys. The results provided an indication of candidate demographics, preparedness for the OSCE, as well as their final professional outcome. The data and results in the upcoming slides to be presented provided us with more insight on these factors. So just as a summary, who is the typical IEN that comes through Touchstone Institute to take the competency-based assessment? They're most likely from the Philippines and India. They're English speaking, have on average between 2 and 10 years of nursing experience, likely have not experienced an OSCE before the exam, and also equally likely to go on to registering as an RN or to remediation courses and programs on their way to becoming an RN. This IEN profile is the key insight that we wanted to bring here, and the type of proactive approach we could take, as mentioned previously, including sharing the competencies being assessed with IENs and directing funding towards programs and courses that could better prepare IENs for these exams. So the study was intended to share some numbers from the field. Just to go over the IENCAP outcomes from 2013 to 2021, based on the results of the survey, results indicated that 43% of respondents passed the OSCE and continued on to register as RNs in Ontario. 51% indicated that they were not successful and were directed to remediation, of which only 44% completed. Majority who did not complete the programs, which is around 24%, cited lack of finances as the main reason to not move forward. 19% also cited limited seats at the college where the education is offered. And it would be interesting to delve further into the 7% who don't complete the remediation through bridging programs and where they go, and whether they continue on in their nursing pathway eventually as they're already in the system. And as part of the next step in the nursing pathway in Ontario to take the NCLEX RN registration exam, majority of survey respondents, roughly 43%, mentioned they were deemed as eligible to write the exam. Of this group, 57% passed the NCLEX RN exam on the first attempt, 10% on the second attempt, and 1% on the third attempt. The remainder 32% did not attempt the NCLEX-RN exam, presumably due to similar factors indicated by the group who did not attempt remediation. In terms of familiarity with the OSCE exam formats, of the surveyed IENs reporting experience with the OSCE exam, majority, around 88%, do not have experience prior to attempting the IENCAP. Qualitative responses to this question indicated that the IENs who do come with exposure to this assessment format is largely through Canadian training programs. Majority of IEN respondents, around 73%, also had not completed a preparation program before attempting the IENCAP. Only 27% had done so. The list above shows the main type of courses referred to by examinees when describing programs completed before the IENCAP. So in the upcoming discussion about another research study that we conducted, we're going to take a look at the IENCAP, which was discussed earlier, as well as the Canadian English Language Benchmark Assessment for Nurses, or CELBAN. And we're going to be sharing the results of an investigation of IEN candidate strengths and weaknesses based on a clinical competency exam. So the IENCAP, which is now the RNCCAP, and the Nursing Specific Language Proficiency Exam, CELBAN. This study aimed to identify IEN strengths and weaknesses using results achieved on the Equivalency and Language Proficiency exam, as mentioned before, and both of which are required exams as part of the pathway towards registration. And this is in an effort to highlight the broader purpose of exams and the results achieved on those exams in a patient-centered perspective, as well as contribute knowledge to regulators and the IENs themselves in order to help inform the critical workforce shortage. The data used was generated from IENs who had completed the performance-based components of the IENCAP and CELBAN exams across 2021 to mid-2022. For the IENCAP, data generated by 546 IENs on the performance-based OSCE component was used. This exam component assesses 14 entry to practice criteria against a recent graduate standard using both virtual and in-person formats. Results typically achieve reliability values of 0.8 and is in line with acceptable values required for high-stakes examinations. For the CELBAN, data generated by 2,263 examinees on the speaking component of the exam was used. The speaking component assesses 7 criteria using a virtual interview method, and results on this exam typically achieve reliability values above 0.9. For the data analysis, both data sets were separately analyzed through the FACET software, which uses the many facets RASH measurement model. And this model allows for factors that are unique to the exam environment to be included directly within the model. This includes facets such as rater scoring behavior, where how leniently or stringently each rater is scoring can be accounted for directly within the results. The data specifications for both exam data sets are shown in the boxes above or on the slide. And for both data sets, the scoring criteria, which is facet number 5, was investigated for model fit as well as logit measures of each criterion. This would help determine strengths and weaknesses overall in relation to the other criteria. So on this slide, we have 2 output graphs, which are called right maps. So on the left-hand side, the right map specifies the CELBAN results, while the right map on the right-hand side specifies the IENCAP results. Outlined in the red boxes are the outputs achieved by the analysis for the specific exams criteria in relation to one another. For the IENCAP, 13 of 14 criteria achieve sufficient fit within the range of recommended values. The results achieved for this analysis are meaningful and can be interpreted with confidence. Looking at each criterion and their logit values relative to one another, collaboration with the client is identified as the easiest criterion in this exam, while physical assessment is identified as most difficult. It should also be noted that collaboration with the client, responsibility and integrity, and communication are almost grouped together in this output and seem to be a separate group from the remaining criteria. And in comparison to the standard, which is the dotted line, 8 criteria function as strengths, which can be denoted by the green dots, and 6 as weaknesses, which are the red dots. For CELBAN, all 7 criteria achieved fit statistics within the recommended range, showing that the analysis produced results that can also be interpreted confidently. Strategies is the easiest criterion for IENs, while grammar seems to be the most difficult. In comparison to the standard, which is again the dotted line, we can identify 3 strengths, which are the yellow dots, and 4 weaknesses, which are the red dots. The analysis of results generated from the 2 assessments, IENCAP and CELBAN, identified that there is alignment in how the results can be interpreted. In the figure above, the easier criteria, or the green circles, between the 2 exams can be identified as strengths, while the more difficult criteria are denoted by the red circles and can be identified as weaknesses. The similarity in descriptions for IEN strengths, so communication, strategies, and sociocultural appropriateness, and weaknesses, physical assessment, organization, and cohesion, and grammar, shows that there is alignment in how IENs can prepare for both exams using the results and feedback achieved on 1. The alignment of results achieved between the 2 exams warrants further investigation, while also noting that these assessment tools are developed in relation to competencies that align with the blueprint and a recent graduate standard, as well as a patient-centered standard. There is potential value in collaboration across multiple assessment organizations to gain better insight into nursing assessments and messaging for optimal usage of results and preparation initiatives. It would be beneficial to examine the results of IENCAP and CELBAN on a larger scale, the order in which the exams are attempted by IENs, and the demographics displaying specific strengths and weaknesses. And this is to ensure that messaging can be adapted to ensure the successful integration of IENs into the nursing pathway towards licensure. So overall, this study identified various IEN strengths and weaknesses at a group level using results achieved in the equivalency and language assessments as part of pathways to registration. The extent to which these results can contribute towards targeted initiatives to help streamline IENs into the workforce, both pre and or post-assessment to solve the nursing crises, warrants further investigation. Considering that the language proficiency exam post-assessment report outlines and caters feedback to each IEN based on their strengths and weaknesses, it appears it would be ideal to sit the competency equivalency exam after having taken the language proficiency exam. This would allow utilization of the results to prepare meaningfully for the IENCAP, which currently does not provide that catered feedback and allows only 1 attempt for the exam. Further investigation into the results on this hypothesis is warranted, though. Having implemented this sort of messaging for another competency equivalency exam, this information can potentially be used to implement similar messaging for the RNC CAP. Alignment of results achieved between the 2 exams does warrant further investigation, though. And I'll pass it on to Karan.
Thanks, Luxshi. So again, certainly acknowledging that the use of assessments, in particular the competency equivalence assessments within the IEN landscape, is evolving at a rapid rate as regulators continue to implement the much needed revised policies to help solve the nursing crisis. The question that we pose, though, is the time ripe to initiate a new position on competency equivalence assessments in our post-pandemic times? So we'd like to think so, but we are the assessment organization and would like to propose a position beyond that of assessments as barriers to rather assessments as solutions, or at the very least parts thereof, and have hopefully provided supporting evidence throughout this presentation for you to agree. Of course, such a perspective does rely heavily on a collaborative effort from all those within the system. So first and foremost, from assessment organizations such as ourselves, there is a need to work closely with regulators and other stakeholders to develop purposeful assessments, as well as policies that better suit the needs of the context and the skill shortage. And secondly, from all other stakeholders, and this includes examinees, education, regulators, etc., is to recognize the larger value that assessments may hold within the system, one that may form part of the solution by helping to inform decisions and target needs at the system level. And with that, we can pass it over to questions.
Thank you so much, Karen, and the rest of the presenting team for that very informative presentation. And we will now jump into the questions. I would also like to welcome Andrea Stronach and Daniel Grossuti from the Touchstone Institute to participate in our Q&A portion of this presentation. And with that, we will now take a look at what we have in the Q&A box. So just bear with me for one moment and we'll jump into the questions. Fantastic. Okay. How long is the cell ban now valid for?
Thanks, Colleen. So Dan, maybe you'd like to jump in with that.
Sure. So we recommend a validity period of 3 years from the date that the assessment was taken. In terms of in practice, it's up to the users of the test scores, so regulators, in terms of how long they accept results. For the most part and for the longest time, the standard was 2 years for the validity period for cell ban. Our understanding is that individual regulators sometimes differ, sometimes make exceptions to this. So depending on what province or territory, it could be different, but our recommendation and what we stand behind is 3 years.
Thank you so much, Daniel. And I think this sort of relates to that. So you may be answering another question, but we'll let Karen direct it to her team. Do you cell ban results for the other 3 components of the test?
Dan, go ahead.
Sorry, I'm not sure I understand. Maybe Ruth, if you could clarify.
Sure, of course.
Or...
they may have just typed quickly, but it says, do you cell ban results for the other 3 components of the test? And if that question is not clear, maybe we'll just have the attendee resubmit that and we can jump into the next question or answer that following the webinar. So we'll jump to the next question. I would like to see the assessments be assessed for cultural bias on non-Anglo country origins of the nurses. This would possibly also inform on the assessment of Indigenous persons in Canada. I am particularly interested in looking at the red circled items in one of the slides, and I'll direct that to the Touchstone team to, Touchstone team to see if they're referencing a particular slide that was in the presentation.
So there was a slide where we had circled the competency equivalence assessments that we specialize in at Touchstone Institute. So I think the person may be referring to that. I was just wondering, maybe Andrea, if you have anything to say based on this comment.
Thanks for the question. It's a really good one, especially as we consider how we can create programs that address diversity, inclusion, equity, and accessibility. So I think you may be referring to the red circles are the competency areas where people haven't met the standard. And that is a really interesting part of the findings that standardized assessment can put forward. And then further study can go on to explore the reasons for why those competencies may be the ones that are most often the areas in which people don't meet the standard. So I think one of the things that we're pointing out is that through assessment, we can actually identify some of these areas. And then through further work together, we can explore what is it that's in the way of achieving those standard requirements. Is it the standard itself? Is it something about the knowledge and the competency learning that needs to be bridged? So partly, I believe that's what we're opening up here with sharing this information about assessments. I would just add that at Touchstone Institute, we have center of communicative competence that has been highly engaged with matters related to social cultural issues, and particularly in terms of communication, but also we have a pretty deep understanding of cross-cultural issues that can impede demonstration of competence, for example, or clear communication, for example. So with that knowledge in the organization, we have created very systematic review of the items and the cases and the stations that we develop to address issues of access in terms of language levels used, so that people who may come from other language backgrounds can easily understand the content. We also review the language for accessibility. For example, if there are cultural references that people from other cultures may find distracting or not comprehend them, we would make an effort to change and adapt that. So we do go through a process. However, I think your suggestion is a really good one. The question might be, how do we team, when we create these exams, pilot it with people who represent different and diverse groups and get some of their insights?
Thank you so much, Andrea, for that very detailed response. Greatly appreciated. Our next question, how do the NCLEX pass rates for the Ontario IENs compare with Ontario graduates?
I'm happy to speak a bit on this one. So unfortunately, we don't have access to that information. So the information that we had in terms of NCLEX pass rates was limited solely to the IENs who had taken our IEN cap and then were willing to take the survey. And so that's how we were able to gather some information about the NCLEX. But I suppose that question basically speaks exactly to the reason what or the argument we're posing to the group today, is using assessment data to inform the system. So being able to access that information, or that assessment organization using that information to share with those within the system to help us make decisions and understand better our nursing applicants or potential applicants.
Fantastic. Thank you, Karen. And I'll just remind our audience that we have some fantastic questions coming in. So please upvote those that you'd like us to get to during our live presentation, and those that do not get answered will be answered by our presenters and then put on meeting place. So with that, we'll go to the next question. What data is the 3-year based on? Are there any studies to guide this decision?
So Dan, I think that speaks to the cell ban specifically, if you'd like to take that.
Sure. So at the time when we reviewed this policy and our recommendation for the validity period, we looked at and sought out expert opinions from language assessment experts in the field. We did a literature review of the research on this topic and looking at language attrition in this as well, and of course used our own assessment data from delivering the cell ban since 2014, and looking at those cases where results expired, which happened rather frequently, and looking at performance from those initial results to 2 or more years later.
Thank you, Daniel. And then I have, what criteria or data did you use to change the validity period of the cell ban from 2 years to 3 years?
Yeah, so really everything I just kind of mentioned, I think.
Okay, thank you so much. And I think that sort of touches on the same. So question is on the validity of cultural bias in the testing and assessments. Would you like to touch on cultural bias?
Andrea, would you like to add to that question based on your previous discussion? Yeah.
Yeah, and if you don't mind, I would like to just go back to the cell ban expiry date for a minute. I wrote in my written answer some details about that. I think it's important for us to recognize that tests are developed and published by assessment organizations whose core competencies are the design, the validation, and the delivery of assessments. And the results are then used by other parties to make a decision. And the other parties that use different assessments will set policies in keeping with their internal requirements. So it's really important to remember that there are many policies associated with exams, not only our exams, but exams generally speaking, and that are determined by the test users. That's how the system is designed. So the exams need to be developed and administered by a third party in order for them to be objective. And those objective results are then utilized for decision making. So some of the policies in place, like the 3-year versus 2-year policy for CELBAN, we are trying to communicate that we feel comfortable with the 3-year result period, but it's not our decision to determine what the validity period is for the test users. So please keep that in mind. It is standard for many language tests to have a 2-year validity period out in the industry. We decided to take an initiative to explore whether the 3-year expiry period is defensible, and we felt that it was. So that's Touchstone Institute trying to do some further research and understanding of how test results are used and how we can, in some very gentle ways, influence our understanding of the use of tests in the environment. I just wanted to clarify that for those participating in this webinar. The second question was about cultural bias. Assessment organizations, when they develop their exams, they go through a cultural bias review process that will identify whether there are discernible, statistically discernible issues with the exam that could impact someone from a different linguistic background or cultural background or other differences, their participation in an exam. A standardized exam is by its very nature designed with a common standard in mind, and that's in a way a limitation of the exam. And it's also why exams have a series of accommodations for different purposes. But I would feel very comfortable saying that Touchstone Institute exams do undergo a fairly rigorous cultural and linguistic review before we publish the exams. I don't know if that answers the question. Happy to entertain another one.
That's great. Thank you very much, Andrea, for outlining that for us. I do have a question. What are your thoughts on the recent changes by Nova Scotia and Alberta on accepting the 7 to 9 approved jurisdictions? And how does this compare to your assessments of the IENs who come from those jurisdictions? So thoughts on Nova Scotia and Alberta, and how does that compare to the IENs who come from those jurisdictions?
Thanks, Colleen. Alex, would you like to jump in and speak to this?
Yeah, sure. I think this is a really good question. And I think that this question at this moment in time cannot be answered fully. We're still early in the process of this regulatory change. I think we're keeping a close eye on it. Of course, for us, this affects who takes part in our assessments. But at this time, I think we're in a phase where we're collecting information and working with the regulators through some of these changes that they're engaged in. It's interesting to see, for sure, that the landscape is changing. For us as an assessment center, we need to ensure that we do keep up with these changes and make sure that our processes and policies reflect this.
Thank you so much, Alex. Changing times, indeed. That one. Do you see the validity period for other language proficient tests being extended beyond 2 years, like CELBAN has been?
Thanks, Colleen. I'll invite Dan, and then maybe Andrea, if you'd like to speak to that too.
Yeah, I might defer this one to Andrea.
And I'll just refer to my earlier comment regarding when a test is operationalized by a test user, it's the decision of the test user to establish those policies. So we wouldn't have any comment on that.
Okay, thank you. Let's see, approved functions, language requirements. talked about cultural bias. Do you have thoughts on what criteria are appropriate to provide exemptions of language requirements? Sorry, we keep going back to language requirements, but it's a hot topic.
It certainly is. So again, I'll invite Dan and Andrea.
I'd love to jump in there on this one, if I may, Dan, get us started. You're asking an assessment organization that question, and you may be interested in our perspective, but it's also important to understand that it's one perspective among many. We've done a lot of work helping regulators understand what a language test can and can't do in terms of demonstration of competence. A language proficiency exam is really important to determine a baseline of language skills that would be required to function optimally. And when you conduct a standard setting session, for example, to identify the minimum language requirements, you are in fact deciding through that establishing of a minimum cut score what an appropriate minimum could look like. The nursing community, the regulatory nursing community has recently done such a study to identify what the baseline could look like, so that the exams that they use are now the requirements on each of the language proficiency exams are the same across the exams that are accepted for language proficiency. So my question would be, how do we align some of the other non-objective evidence of language proficiency with this kind of minimum that regulators and practitioners have agreed upon? So that would be a question that I'd be really interested in knowing, because I do think that there are a lot of IENs who bring in very strong English language skills that have to take the CELBAN. We've seen them, and that doesn't seem quite right. On the other hand, understanding how strong your language skills are before you step into really high stakes client-facing situations is also for IEN protection, for anybody's protection, to be comfortable and confident in their ability to communicate clearly in very stressful and sometimes potentially high stakes situations. So I propose that as some food for thought. I don't have an exact answer for that because it is complicated if we're using non-objective evidence of proficiency, which I'm definitely not opposed to. I think it's really important to have many alternatives. How do we think about the fairness that aligns the different ways in which you can demonstrate language proficiency, so that everyone who has demonstrated language proficiency in different ways can have a similar opportunity to demonstrate the minimum level of language proficiency before they proceed in their registration process?
Thank you so much, Andrea. Did anyone else want to contribute to the question? Nope, we're good. Excellent. Are there plans to assess with French IENs in the future?
Alex, would you like to take that one?
I think that's a good question. Something that we've been tackling here at Touchstone Institute is we currently all of our exams, besides one smaller exam for an organization, is mainly English. I think we are in executive discussions around whether or not, and it's not just translating, it's sort of, we call it transadapting, because a simple translation from an English version to a French version would not be able to validate the exam itself. All of our exams in English go through a validation process where we select subject matter experts and target participants to verify if the exam is appropriate. So similar process would happen in French. It is a highly costly transition and something that we are still discussing internally. I know that there is a lot of action and movement going on with some of the French nursing examinations in Quebec, and something that we've been keeping a close eye on. But at this point in time, we don't have a decision. We're not engaging in any transadapting of our English exams to French.
Excellent. Thank you for that background information, Alex. I apologize if I asked this question. I'm just going to put it out there again, just in case. Do you plan to expand the review of other jurisdictions? And I don't think we got to that one.
We didn't know.
Okay.
Alex, again, would you like to jump on that?
Yeah, actually, this is actually a really good question. As one of our initiatives, and I saw a question earlier about what are the differences between an IEN cap and an RNC cap. For our exam, for the IEN cap exam, that was provincially specific to Ontario, based on the competencies that were utilized to assess RNs at that particular time. Considering the shift to a more common competency profile or framework across Canada, we took this opportunity to redevelop the IEN cap into an exam that could be utilized across different jurisdictions all across Canada. So that's why we've there are subtle differences. It is an OSCE only examination for the RNC cap, whereas prior iterations of the IEN cap, there was a written component as well. So the name itself reflects the fact that it can be utilized in different provinces, of course, if regulators accept the examinations. With that being said, the expansion of the RNC cap could include more data driven initiatives or research across Canada. That's our hope. That's our initiative, but something at this point in time we do not have the luxury of having.
And maybe I'll also add to the differences between those exams is the purpose of the two exams remained the same. As Alex said, we moved to a national blueprint for this exam as opposed to being Ontario specific. We also try to design the exam to be more efficient and accessible for the IEN. So it moved to a shorter OSCE component as opposed to a 2-component, which used to be MCQ and OSCE. And it is also available to be delivered in both an in-person and a virtual format, which is really a key advantage for the IEN too in taking that exam. So quite a bit of a revamp, not in terms of purpose, but definitely in a more efficient, streamlined format.
Thank you both. And I think we're coming to the end of our presentation. It looks like we have 2 more questions that we'll try to get to, and then we'll wrap up. So do you have results for the other 3 CELBAN components?
My guess is this question is related to Luxshi's presentation and the chart that she showed that had the 7 criteria for the speaking assessment there. I'm not sure, Luxshi, if you have any comment.
Thanks, Anne. I can actually jump in and speak to that research that we had done. So we had limited it just to that specific component and not the others. So we wanted a performance-based component to use for that study. And so the other 2 components were not included. So we do not have the results, at least on hand, for that.
I think this actually touches on our last question. So it says, could you share how many other competency exams exist in Canada for IEN competency that regulators use, and give us an idea of the collaboration or lack of in this field?
So Alex, I'll give you the last opportunity for the question.
Thanks, Karen. This is not exactly a straightforward question in the sense that I could give a straightforward answer, but all regulators have their own process of identifying educational equivalence. In the past, they've used several methods to determine whether or not an IEN has educational equivalence. The purpose of our competency assessment is to create a more efficient way of identifying educational equivalence for IENs, for the RN specifically. We do know of one other big organization that also assesses internationally educated RNs, as well as internationally educated RPNs, LPNs, that class of nurses. In terms of whether or not there's collaborative opportunities, this is also a not as a straightforward question, just because there are differences in approaches to assessing competence for internationally educated nurses. There's been opportunities for us that we feel have arrived, but I think that there are subtle differences in the way our approaches are to evaluating individuals' competence.
Thank you so much, Alex. Of course, I left the tricky question for the end, so thank you for wrapping that up for us. And with that, I'd just like to thank Karen, Alex, Luxshi, Daniel, and Andrea for taking the time to participate in today's discussion and presentation. And many thanks to you, the audience, for joining us and engaging with us today. You are welcome to join us at our upcoming events, and I'll just pop up our deck so that you can see what our next webinar is in June, and hopefully you will be available to join us at that point. There we go. And if you missed any part of today's presentation or would like to watch this session again, we will post the recording on the N4 platform within the next week. We want to continue the dialogue. This presentation has started. We will be moving all of the questions we did not get a chance to address to N4's online moderated discussion forum called Meeting Place. We have invited our panelists to respond to your questions there if you have any following the webinar. We also have curated several resources related to today's presentation topic. You can find these in our resource toolkit, and we will link them when we share the on-demand version of this discussion. So if you haven't yet, please sign up, newcomer navigation.ca for all our resources and learning opportunities. Following today's session, you will be invited to complete a survey to share your feedback with N4. These surveys help us continuously improve and seek out new webinar content and opportunities that are responsive topics you are interested in, our audience. We kindly ask that you follow the link and complete this brief survey. So that link will be in our chat box. You're currently looking at our N4 mobile app on Apple and Android devices, and through the QR code here on the left-hand side, going to newcomernavigation.ca/iOS on Android. And thank you again. We hope you can join us at a future N4 event. Stay safe and well. Thank you to our presenters, and we look forward to seeing everyone at a future webinar.